how do we approach healthy eating for teens? What is your advice for that? The teen doesn't like vegetables, doesn't like, certain types of protein. And so how do we encourage our teens to change some of that, or to motivate them? Because as toddlers, we hear about these toddlers who are picky, but what do we do when they're older, 13, 14, 15, and they're still some of the foods that are leading to weight gain?
Yeah, so I think, again, we have to start with what the patient's goal is. And certainly it's challenging when it's a child, because the parents' goals may not be aligned with the kids' goals, and the kids' goals, they may not understand the bigger picture. Like, you and I and the parents understand why prediabetes is a concern and something that we want to address, but they may not understand that necessarily. So sometimes talking about, like, what are your goals for your life? What would you like things to look like for as you get older? Here are some realities with your numbers, and this is something that can be genetically predisposed and something that lifestyle affects. We can't change your genes, but we can change some things in your lifestyle to try to help you have a better outcome here. What are some things that you think that you could do? I think also important to mention here is a lot of teens who do live in larger bodies and have family members who have struggled with prediabetes, diabetes, have been on diets. They have observed that behavior, and they may already be engaging in some eating disorder behaviors that are affecting them. And screening for that is super important. So there's several validated screening tools that you can be used for eating disorder behaviors. The most commonly used one that I have heard of is the SCOFF, but there's others as well. I think screening for those behaviors and being aware, because it's going to be very challenging to make any progress in lifestyle change if someone is dealing with an eating disorder. We know that children as young as 6 who have observed or have experienced, comments about their body, start having thoughts of wanting to lose weight as young as 6. And so dieting behaviors can start very early. And dieting behaviors can be really problematic for prediabetes and diabetes because there is that inconsistency of intake. So there's maybe dieting and restriction, and then there may be compensatory binging, or there may be binging and then purging, like a lot of these things that can be going on. It's not as simple as like eat different food. There's a lot of behaviors that have to be considered. And so really kind of screening for that and getting them appropriate help if they do have eating disorder behaviors.